Why do I have to explain the same thing over and over and over again to 100 different people when I go to the hospital when something's wrong with me? Why? Why is that? So this drives patients crazy. It drives parents of patients crazy because I've been through this with my son who's had multiple different brain surgeries and was in the NICU for 116 days. Why on earth do we have to explain the same thing 1,000 times? So let's take something simple like that we deal with every day, like appendicitis, okay? So you come in and you're complaining, your chief complaint is right lower quadrant abdominal pain. So you show up to the ER, they register you and you check in, okay? So then your ED, or again, people get these things confused too. Emergency department, emergency room, emergency medicine, all these are interchangeable. So your ER nurse comes to see you, okay? So they ask you what's going on. Then you're at a teaching institution. So the EM resident comes to see you and you tell your story again. And then the emergency medicine attending comes to see you and you tell your story again. Okay, so we're already at 3 just in the ER, and that's if there weren't any other people in there too asking. So I'm gonna cut it down like a lot. So then they get a CT scan and your CT shows that you have acute appendicitis. Lucky you. So they call our friends with acute care surgery, and I send the medical student who is on their surgery rotation. And so you explain it to them. Then they go and report it to my chief resident who books the case. And then I come and see you in pre-op. That's 3 more. Then when you're in pre-op, the circulating nurse comes to see you. The CRNA comes to see you. The anesthesiologist, you guys love my handwriting, comes to see you. I have 3 more. So it's like exponential. So we're at 9 people alone, guys, just to get you into the OR, okay? So I hope you understand that, and it's not because we want you to repeat yourself. It is important for patient safety. And again, we need to really drill down and get to the bottom of what's going on, asking you about your allergies, and especially if there's different sites of surgery, I'll do a whole video on timeouts. But again, this is for patient safety, it's for your safety, and that's who we care about.